Hello everyone, and welcome to Chapter 9, The Principles of Pharmacology. We'll just skip over that. This is Keith Whitmire here with Wayne County EMS. Pharmacology. What is pharmacology? It is the study of drugs or medications and their effects on living systems. Now we're going to get a little more complicated. Pharmacodynamics is the study of the effects of drugs and their mechanisms of action at target sites in the body. You must be familiar with the medications carried on the EMS unit and physician-prescribed medications that medical direction will authorize you to assist patients in taking. Although drugs may be life-saving when properly given, they may be fatal if improperly administered. You must be knowledgeable about each medication that you administer. Alright, let's get started into some drug legislation. Alright, drug legislation protects the public from contaminated or mislabeled drugs. We'll start off with the Drug Importation Act from 1848, which requires U.S. Customs Services inspectors to stop entry of contaminated drugs from overseas. Then we've got the Biologics Control Act of 1902, which passed to ensure purity and safety of serums, vaccines, and similar products used to prevent or treat diseases in humans. Then we have the Pure Food and Drug Act. This was established in 1906 and prohibits interstate commerce in misbranded and impure foods, drinks, and drugs. In 1912, we have the Shirley Amendment. This prohibited labeling medicines with false therapeutic claims intended to defraud the purchaser. If you've ever seen any Western or anything where they talk about their elixirs or their magic serums, that they're cure-alls, and this is the law that banned that. 1914, the Harrison Narcotic Act, which establishes the word narcotic, required prescriptions for products exceeding the allowable limits of narcotics, and required increased record-keeping for physicians and pharmacists who dispense narcotics. In 1937, the elixir of sulfanilamide kills 107 persons, and many of whom were children. In 1938, the Federal Food, Drug, and Cosmetic Act of 1938 was formed. This required that new drugs be shown to be safe before marketing. Established the FDA's responsibility for supervising and regulating drug safety, authorized factory inspections, and required that drugs contain a label listing all of the ingredients and directions for use. In 1951, we have the Durkheim-Humphrey Amendment, which required that prescription drugs, also called legend drugs, must carry the following label: Caution, federal law prohibits dispensing without a prescription. In 1962, the Kefauver-Harris Drug Amendments passed to ensure drug effectiveness and greater drug safety, and drug manufacturers required to prove to the FDA the effectiveness of their products before marketing them. We're actually starting to see that now, starting to see it again. They're starting to require some drugs that have been on the market for years for those companies to, again, prove their effectiveness. For example, nitrostat has just been taken the generic has just been taken off the market until they're able to prove the effectiveness of the medication. 1970, the Controlled Substances Act established 5 schedules, which are classifications of drugs based on their accepted medical use in the United States, abuse potential, and potential for addiction. In 1983, the Orphan Drug Act enabled the FDA to promote research and marketing of drugs needed for treating rare diseases. With this pretty much put a lot of money into drug companies for developing drugs that not many people had, because if this act didn't come into play, nobody would ever make any progress on these drugs because it would not be profitable. 1988 Food and Drug Administration Act officially established the FDA as an agency of the Department of Health and Human Services. 1990, an Anabolic Steroid Act identified anabolic steroids as a class of drugs and specified over 24 items as controlled substances. The Drug Enforcement Agency is a division of the Justice Department. It became a sole legal drug enforcement agency in 1973 and replaced the Bureau of Narcotics and Dangerous Drugs. The Food and Drug Administration is part of the U.S. Department of Health and Human Services. It enforces the Food, Drug, and Cosmetic Act by means of seizure and criminal prosecution as necessary. Drugs can be obtained from many sources. Morphine, a common drug used to relieve pain, is an example of a drug obtained from a plant. Some drugs are obtained from minerals and mineral products, such as iron. Advances in technology have enabled drug companies to make many of the drugs formerly obtained from animals and humans, such as insulin and some vaccines, in laboratories. Drugs that are made in laboratories are called synthetic drugs. Semi-synthetic drugs are naturally occurring substances that have been chemically altered, such as antibiotics. We're going to look at a drug profile here. During a drug profile, we'll note a chemical name, a generic name, and a trade name. The generic name, for example, albuterol. This is the name that you may hear commonly referred to as. The trade name is the name that it was initially patented under, or may be patented under. Trade names for albuterol include Preventol and Ventolin. And then the chemical name is the chemical composition that it was created under. And for albuterol, it's alpha-1,4-hydroxy M-xylene alpha-diol sulfate. You can go through and take a look at some of these other drugs in here. Before giving any medication, you have the responsibility to the patient to know as much as you can about the drug you'll be giving or assisting with. There are many sources of drug information available to help you find out more about the drug you're giving. The U.S. Pharmacopoeia is an official publication that contains information about drugs marketed in the United States. It lists approved drugs and gives directions on their general use. The American Hospital Formulary Service is published by the American Society of Hospital Pharmacists. It's available in hospital pharmacies and at most emergency departments. It contains information about drugs for FDA-approved use, as well as some investigational uses of medications. PDR, which is a physician's desk reference, is well known in by healthcare professionals. This publication contains a collection of package inserts provided by drug manufacturers. The information includes the accepted use, dosage, and side effects for commonly available drugs. It lists specific drugs for FDA-approved use. The PDR also contains a product identification guide showing actual sizes and color pictures of commonly prescribed drugs. Patient package inserts are published by the drug companies. They're required by law, and their content is approved by the FDA. Other sources of information include pharmacists, poison control centers, and drug references provided by medical publishers. Excuse me. All right, now it's off to drug forms. Every drug is supplied in specific form by the drug's manufacturer. This is done to allow properly controlled concentrations of the drug to enter the bloodstream where it has an effect on the target body system. A drug's effects may be local or systemic. Local effect of a drug usually occurs only in a limited body part of the body, usually at the site of the drug application. For instance, if you apply calamine lotion to a rash on your leg, the effects of the drugs are limited to the extremity where the drug was applied. Drugs with systemic effects are absorbed into the bloodstream and distributed through the body. For example, when you go to see the dentist to have a cavity fixed, he gives you an injection in the mouth where the dental work will be done. The drug used is often in combination of lidocaine and epinephrine. Lidocaine numbs the area, a local effect, and epinephrine constricts the blood vessels in the area to limit bleeding, a local effect. However, another effect of epinephrine is an increased heart rate, which is a systemic effect. Gases are breathed and absorbed through the respiratory tract. Major example of this is oxygen. Liquids contain medications that are ground into a powder and mixed with a substance, such as water. Some examples of liquids include elixirs, emulsions, gels, lotions, and suspensions. Solids are a drug that is in solid form and usually swallowed. Not always. We actually have some that go sublingual, which we'll get into a little later. This requires a responsive patient who is cooperative and has an intact gag reflex. Alright, the drug profile. You must be knowledgeable about each drug you give, including the following: the mechanism of action, which is how the drug exerts its effects on the body's cells and tissues; indications, the conditions for which the drug has documented usefulness; dose, the amount of the drug that should be given to the patient; route of administration, the route and form in which the drug should be given to the patient; contraindications, the conditions for which a drug should not be used because it may cause harm to the patient or offer no improvement to the patient's conditions or illness; adverse effects, which are undesired effects of a drug; special considerations are factors to consider when the drugs, such as the impact of age and weight on medication administration, children, older adults, pregnant patients, for example, tips for administration of these drugs. Alright, that is the end of our lectures for Chapter 9, Principles of Pharmacology.